Hello, everyone. It's Monday, July 13th, and I'm glad to be with you today. I'm going to give you a couple of updates as I usually do. We do have a guest speaker today to talk about contact tracing, and then I'll give you some additional highlights that I think would be important for you to be aware of. So glad to be with you today. First of all, our case count and situation update. So as we typically do on Mondays, we like to talk through what happened over the weekend. We no longer post over the weekend on social media. So sometimes the numbers that Department of Health Services posts are not exactly the same as what case numbers we got in. So I like to clarify that. On Saturday, we had 8 total cases that came in. And on Sunday, we had 4 cases that came in. Today, so far, we have 15 positive lab reports. 11 of those are from the National Guard testing event. So we're beginning to get some of those test results in. Additionally, it looks like they're pretty split 50-50 for males and females. And also they run everywhere from the teens up to the 70s, with 4 of them being in their 20s and 4 in their 50s. And again, 11 of those 15 are from the National Guard testing event on Friday. We also have a total then of 593 lab confirmed cases. 180 of those are currently open and active cases, meaning 413 have recovered. So that means that 30% of our total cases are open and active at this time. We have 4 individuals who are hospitalized. And in the state, we have today's numbers were 494 positive cases from yesterday to today. I do just want to point out that Saturday, Friday, and Thursday were each record-setting days for the total number of positive cases in Wisconsin. So Thursday was a record-setting day, then Friday came out and was higher than Thursday, Saturday higher than Friday. So today it's nice to see it's a little lower than that at 494. The state has a total of ever hospitalized of 3,850 and for a positive of 26 new hospitalized cases since yesterday with the state numbers. Also, total of 820 individuals in our state have died from COVID-19, and that is up 0 from yesterday. The state's total active case percentage is 20%, and again, that's compared to our 30% of active open cases. A note of clarification about our negative test results. We received a communication today from the state that indicated due to an error in the way that the extraction comes out from the state's database, our total negative test results in Crosse County have been overreported by 400. So that means there are 400 more in that number at the state of negative tests than we actually have had, and they will adjust that tomorrow. So I know we have some folks out there who are tracking data and following that. So we wanted to make sure you understood when that happens tomorrow, what was going on there. And if you are one of those data trackers and would need that by date, we can get you that information so that you can plug that into your tracking systems. Next, I'm going to introduce Becky Lakowske. Becky is a health educator in our department, and she has been doing contact tracing, and she's going to share with us some more about what contact tracing is and some important points for you to be aware of as it relates to contact tracing. Thanks, Becky, for being on today.
Hi, thanks, Jen. Like Jen said, my name is Becky Lakowske, and I'm a health educator at the Crosse County Health Department. My current role is to support the disease investigation team through contact tracing and helping to train new contact tracers. A few weeks ago, public health nurse Brini Weigel was on one of the press briefings to explain a little bit about the contact tracing and disease investigation team. However, since she was on, I think we've seen a really large increase in cases, which brought on and renewed interest in what contact tracing is. We've also used the words sending individuals to state. We've thrown the terminology out quite a bit, and we've had questions about what does that mean? what does it look like? How does it impact our team here? And what are we doing here in La Crosse County to be able to handle the surges in cases? So I've been asked to join today's press briefing to do my best to provide a little bit of information and answer some of those questions. I'm going to start by just trying to give a brief overview of what Brini had already previously talked about, explaining a little bit about what our disease investigation team does. So the La Crosse County Health Department has a team of individuals that we call our disease investigation team, and it consists of investigators and contact tracers. The investigators are the individuals who work with those who test positive for COVID-19, and they provide them education and support. They also work with the individual to monitor their symptoms, find out how they're feeling while they are sick and quarantining. They also speak with them to try to help to identify those who they've been in close contact with. And a close contact is defined as any individual who has been within 6 feet of contact with a person who was infected for more than 10 minutes throughout the day. And then the infectious period starts for the person 2 days prior to the onset of symptoms. So we'll talk to the individual who tested positive and find out when they first felt that they started experiencing symptoms, and we'll go back 2 days from that date. As if the person happens to be asymptomatic, we will find out what day they tested and go 2 days back from the date that they first tested to find out who are their close contacts. When the close contacts are identified, then the investigator will reach out to the contact tracer, and the two of them will work together to get a hold of the contacts. Most of the time, the individual who tests positive for COVID-19 does give their individual a heads up, so they are aware already that they have been exposed to somebody who tests positive for COVID-19 prior to us calling them. But there are times that we give them a call and they had not known prior to our call that they had been in contact with somebody who tested positive for COVID-19. Once we give them a call, then we let them know that they have been exposed to somebody who tested positive for COVID-19. We give them a recommended quarantine date, discuss what that quarantine looks like. We provide education and support, and then set up a way to stick with them throughout their quarantine period to see if any symptoms develop. So we can do that by giving them a phone call every couple of days. They can do self-monitoring, texting, or email. We really work with the individual to find a process that works well for them. So that way they know we're available if they have questions or symptoms develop. If symptoms do develop, then we would advise, most likely we would advise that they get tested, but we do talk that out with the individual and see what works best for them. For anyone that is a close contact, what we're asking of them is we ask that they stay home as much as possible. Most individuals should not go to work. We recommend that they do not use public transportation. We want them to be washing their hands often, really trying not to leave their house at all. If they do, it's for absolute essentials. And it sort of does also depend on what level exposure they had. The ones that I'm referring to currently are for individuals that are at medium risk. We also assess a high risk, which may be the same steps, but really trying that extra hard to not go out for those essentials. We also ask that they postpone all non-essential medical visits. And when somebody is quarantined, we are asking them to try to minimize contact with those inside their household. And that means using their own room, if possible, using their own bathroom, and then avoiding sharing any household items like washcloths, dishes, or bedding. And this is because if they become sick at any point through their quarantine period, they are then decreasing the risk of spreading the illness to those in their household. An individual also would not have to be contacted by the health department to start taking these measures and trying to quarantine. So if somebody is contacted by an individual, letting them know that they are a close contact of somebody who tested positive for COVID-19, they can begin doing all of those quarantining suggestions right away before they're contacted by the health department. If they continue to not hear from the health department, they can reach out to the La Crosse County Health Department, and we plan to follow up with all close contacts, but just if they haven't heard from us and there are any questions, they can reach out to us at any point. On that note, both the investigation process and the contact tracing follow-up do take a lot of time, and there are only so many hours in a day that you can get a hold of someone. So when we started seeing an increase in cases in La Crosse County that happened kind of quickly and then continuously, it really became impossible for us to get in touch with both contacts and their cases and their contacts in a timely manner. So this is when we reached out to the state's communicable disease team for assistance from their investigators and contact tracers. Any community can reach out to the state for this process. What they do at the state level is very similar to the process I just explained. And what we do is we get the individual's name and then we assign it to somebody at the state level to do that initial phone call and education with both a person that tests positive for COVID-19 and their contacts. We are super grateful that this resource was available. It really helped us to get a hold of individuals when we would not have been able to get a hold of them. However, this process, as I said, their name still comes initially to the La Crosse County Health Department staff. We assign them out to the state, which adds an extra step to the process. And there are times when we could be working together as a team to try to identify themes, maybe connections within positive cases, that if we're sending them out to the state, it does take a little bit longer and does kind of cause a delay in the process. So ideally, we would like to follow up using La Crosse County Health Department staff to make the connections and identify individuals and themes as quickly and as thoroughly as possible. However, we are grateful that this assistance was provided to us, and we will continue to utilize the state assistance if and when needed. When we first reached out to the state a few weeks ago to assist, La Crosse County was one of just a few counties in the state that were seeing a surge in cases. I've heard recently now that we're seeing record numbers of positive cases in the state, and even that state resource now is being stretched with the number of calls and contacts they can make in a day. So we are working really hard here in La Crosse County to make sure that we have the staff that we need to respond to the fluctuating number of cases that we have in our county. We have recently brought on 14 new individuals onto our contact tracing team. And over the last 2 weeks, we've been training them. They've started making phone calls and have really been a great resource to add to an already awesome team of individuals. We do not plan to stop there. We continually assess our ability, the need in our community, as well as our ability to respond to that need, and are looking at bringing on more members to the team in the near future. And we'll continue to have this conversation moving forward to make sure that we are getting a hold of individuals and reaching them and providing quick and an efficient response and follow-up. However, on that note, we could have a million contact tracers and investigators, and if people are not answering their phone, we're still not going to be able to make that connection. So I know that if anybody is like me, they're not a big fan of answering strange numbers. So they will let the calls go to voicemail. But if you could just try to pick up your phone and get a hold of us, we are people in your community understanding what you're going through, dealing with the same thing. We just need to get a little information to you, make sure that you're aware of the current status. And two, if you don't answer your phone, if you miss a call from us, you could be proactive in making sure that your voicemail box is not full. So we're able to leave a message. We do leave messages for individuals. We will never leave personal information on the message, but we give you our name, the health department, that we're from the health department, and a number to call us back. So if you do get a message from the health department, calling us back as quickly as possible really is critical. And then I could not mention all of that without saying that at this point, we have had hundreds of positive cases in our community with thousands of contacts. And overwhelming number of individuals have been great to work with a really positive response. It can be pretty intimidating to pick up that phone and start making some calls when you don't know how the person on the other end is going to react to your phone call. So I would say overall, the La Crosse community has been really great to work with. People are answering their phone. They have lots of great questions. They're looking for the education that we have to offer. They stay in touch with us throughout their quarantine period. And I really can't say enough great things about the community. So for those that aren't answering their phones, I think just a quick plug to please try to pick up that phone. It's not a painful process. We really try hard to be kind and speak with you and figure out where you're at and make sure you have the education and support you need. And a huge thank you to all those that have been working with us over the past few months. Also, I want to use the opportunity to thank the disease investigation team for just being a wonderful team to work with as well. With that said, I think I'm going to pass it back to Jen.
Thank you, Becky. That was very helpful. There's a lot of information there, but I think what is most important to reiterate out of what Becky just told us is that if you know that you've been a close contact, or even if you think that you've been a close contact, or you have been in one of the locations that are listed as high risk on the public notification sheet on our website, those are all situations in which you should not wait for us to call you. You should be in quarantine, and you should be making sure that you are not part of spreading COVID-19 in our community. So until we are able to connect with you, take those actions and be empowered to do the right thing. Even if, again, you aren't sure, but you think so, and you've contacted us and are waiting for a call back from our office. So I think that is so important for you all to know that you have the ability to take the right steps even before you hear from our office. As we begin to take a lot of those contacts back with the addition of the staff that we've hired, I just want you all to know that these individuals that are hired by our department are all local. And it's not just about giving you instructions that you may think you already know. It's about a relationship that can include support. Sometimes individuals are really worried about how they'll be able to quarantine or isolate if they can't be at work, and we work through that with you. We have access to resources to support individuals to be able to quarantine and isolate. So as Becky indicated, even if it goes to voicemail and we leave you a message, call us back and let us know what is the best time to reach you. What is an email address that we can communicate with you by? Give us the information to connect with you so that we can get you the information and support that you need in order to do the right thing and protect our community as well as your loved ones. Again, the whole purpose here is to decrease the spread of COVID, and any delay in that process, including if it takes a bit of time for our contact tracers to get the contact name and number, then when we make that phone call to touch base with you as a potential contact, if we don't reach you right away, that can delay the process even further. And you could already be in the infectious stage and not even know it, again, because when symptoms began, you can be spreading 2 days prior. So I cannot emphasize enough how important it is, even if you let it go to voicemail because you're uncomfortable answering an unknown number, call us back right away. Our contact tracers will leave their name, their number, the way to reach them, and get a hold of us so we can make sure that we can help you stop the spread of COVID-19. At this point, I do also just want to note, we have heard that there are individuals who are part of scams, and you may be worried about whether or not the person calling you is truly from the health department. So we will never ask for financial information. We will never ask for your social security number. Those are not parts of our processes. So those would be red flags right away. If someone is asking for that information, that is not our team. If you are really uncomfortable with the way that the call is going, and again, predominantly it's about education and information, you are welcome to say that you need to hang up and call back. The person should give you their contact info, and you can call the person immediately back, or you can call our department to verify that that name of that contact tracer is one of our staff. We want to help you be safe and not be at risk of something that may be not legit, might be a scam. So, but just remember, we don't want that to be delaying the process. So just wanted to let you guys know about that. That kind of leads into my next topic, which is misinformation. As we move along with COVID-19, there's a lot of information available to us on the internet through various groups out there. And I just want to reiterate how important it is to verify the information that you are using to make decisions, that you might be sharing with others. It's really easy for misinformation to be shared. If we believe that it is true, then we are much more likely to share it. So remember that there are specific sites and sources where you should really be looking for this information. So some of those include, of course, the CDC, the Department of Health Services, our website. Also, I would suggest locations like, healthcare systems, Mayo Clinic, university systems. So University of Minnesota, Wisconsin, Johns Hopkins as well. And also, if you're looking for articles, if you go on Google and type in Google Scholar, you can find articles and be able to retrieve those that are available to you if you are interested in scholarly articles and research in that format. So I guess the most important thing is to make sure that the sources you're using are really factual. And if you ever have a question, even if you think we may not agree with your source, feel free to reach out to us by private message on Facebook or contacting us and just asking if we could verify that your source is actually factual and legit. We're happy to help you with that, because one of our primary roles is to make sure that you have the information that you need to make good decisions. So we're happy to assist with that. And I think that as we continue along with COVID, there are a lot of unknowns. And while there are unknowns, that really raises anxiety for individuals and people. It's just part of human nature that when we don't have known answers, we may seek answers that are not factual in order to fill that gap. It does take time for us to really get the research in about what COVID is doing in the United States. Currently, we have a body of knowledge that is beginning to develop from other countries who had it before us. But again, we are talking just a matter of months here, and the literature continues to move forward. So every week we get new information in this sort of body of knowledge about various aspects of COVID. So an article from April, for example, is likely outdated at this point. So also be aware that we should be trying to get the most up-to-date information as well. I wanted to talk a little bit about the risk levels associated with COVID-19. So we do talk about the most concerning risk, which is death. We call that mortality, but there are also significant long-term health effects that we are beginning to learn more about. And as we get additional information and evidence about those, we will share those. But I just want to make sure that we are all aware it isn't just about death, and there can be long-term health effects that we are still learning about. So I say that because it may seem like, since we haven't had any deaths in La Crosse County and most individuals do not require hospitalization, it might feel like it could just be like getting the flu and what is all the fuss about, essentially. And just remember that there are a lot of unknowns yet about COVID-19, and our job and priority is to prevent COVID-19, prevent anyone from getting COVID-19 if at all possible, and then also prevent the spread so that we can decrease the total number of individuals who get it and may be at risk of those potential health effects, as well as the most serious one, which is death. So I just want to point that out as information for you to be aware that there are various risk levels associated with this particular virus. The isolation and quarantine enforcement officer position that we posted on our website, this is another area where I've seen a lot of misinformation, and it seems that it's been perceived in a very different fashion than that position really is for. Very simply, we have isolation and quarantine sites so that if we need to support someone in isolation and quarantine, to include an individual that cannot isolate or quarantine at their home or don't have a home to go to, that's the point of those isolation and quarantine sites. And we've had those in place for a number of months now. We also have individuals who would support the site in terms of making sure that the site is running and the individuals in that site get what they need. Those individuals, if they are in a site, typically are there on a voluntary basis. If for some reason someone becomes non-compliant, which can occur for a number of different reasons, then it might be that as the health officer, I need to place an isolation order. And when that occurs, then the enforcement officer position is meant to support the site from an enforcement angle. So I think that it's a very big misnomer that that position would be there to guard someone's private residence. That is simply untrue and would not be something that we would do. So I just want to clear that up and let you all know what that position really is for. A lot of what we do in the health department is prevent the spread of disease, and also prepare for situations that may be very rare, but could be very concerning. And this is one of those situations that, again, if we have an individual that is actively infectious and is not complying and is likely at an isolation and quarantine site already, that is the point of that enforcement officer position. So it seemed to me what information was being shared was not correct and may have elicited fear in a number of individuals in our community, which I felt was not necessary. And I just wanted to make sure to clear that up. Lastly, I just want to reiterate that, again, as new information comes out, as research is conducted, every time that we get a new piece of information, it builds on a body of knowledge that we already have. So new evidence is coming out all the time. There are a lot of unknowns about COVID, but that is what we see as a primary role that we have. And hopefully that has been coming across to you, that transparency is one of the most important values that we have in the health department. And so we continue to follow that value and will always share with you the most up-to-date information that we can. Lastly, I wanted to talk about the National Guard testing site. So we just had a testing site on Friday. It was very successful. We were able to conduct 400 tests of individuals with symptoms in our community. It's the first time actually we were able to maximize the number of tests that we had available. Actually, we had a few folks that were there at the very end that we couldn't get tested, that we needed to have them go to their healthcare provider. We have another testing site coming up, and I just received confirmation about the site date and location and time. So that will be on July 24th, and it will be at the Omni Center in Onalaska from 10 to 4. So I wanted to let you know that has been confirmed by the National Guard. So again, July 24th, Omni Center in Onalaska, 10 to 4, and we will get more information out to you. If you were tested on Friday and you hear that we've had some test results coming in, so that's really good. We'd like to see it be 3 to 5 days. So today is 3 official days since the testing site, to include the weekend. We would like to let you know that you may receive, if your test result is negative, you will receive a call from the National Guard, which again might be an unknown number. But if you were tested, please be willing to answer those calls the next couple of days to make sure that you get the test result. If your test result is positive, then the health department will be contacting you. If you have not heard about your test result, I would say towards the end of the day or the late afternoon on Wednesday, that's when I would say reach out to us and let us know that. And the number to call would be our COVID hotline number, which is the 785-6240 number. And again, if you were tested on Friday, you should be in quarantine or isolation, actually, because you have symptoms. If you were tested, you should be isolating in your home, not going out and trying to get anything, having someone else get that for you, trying to keep yourself away from other household contacts to minimize spread, and not going to work until you get your test result. Again, that is because you were symptomatic, and that's why you were tested on Friday. So please be in isolation until you get those results from us. With that, I think I have spoken about all of the updates that I have for you today. So I will now take questions.
Hey Jen, it's Mike at WXOW News 19, and this question is for you or Becky. In terms of contact tracing and investigation, letting people know that they have COVID-19, I know the system is very overwhelmed right now. What would it look like for the health department to catch up in getting in touch with people? How far behind are we?
Yeah, so in terms of contacts, I would say that we are getting caught up. What you ask about predominantly is, so we had been sending cases and contacts to the state. We are now taking those cases and contacts back. So we're in the process of taking all of those cases and contacts back, but it is a transition time period as we get more cases in to make sure that, again, it was about training up those contact tracers. So we are definitely catching up and should be able to communicate to those that are positive from the testing site last Friday or any contacts that are being identified. We should be on top of that fairly well at this point. And we have also put in place a couple of new processes to help make that a little faster. So for example, if we have a day where we get a lot of new positive cases and we can't make all those calls in the same or the next day, what we're doing is we're calling them to give them the instructions and to give them a link to a HIPAA compliant form that they can complete for us to give us the information. It doesn't replace the interview, but it gives us a little bit of time to make sure we're getting the key information shared both with them and from them. And then we can get the interview in a day or two from there. So we've got a couple of new pieces to our process to make sure that we can get that information quickly. And again, this is all about making sure an individual at least is aware that they're a lab confirmed case or that they are a contact and what level of risk they are, what to do with that information, and then also getting information back to know where have they been in the community and again, who are their contacts so that we can get a hold of those contacts as quickly as possible.
Jen, we have a question from Fox 2548 asking, do you believe that we maxed out on the tests on Friday at the National Guard testing site because it was the first testing site since the surge in cases?
Since the surge in cases, it's hard to know. We have been doing a lot of testing in our community, even without that testing site from National Guard. We've been seeing a lot of testing maxing out at our healthcare systems. So I think that tells me there's a lot of virus in the community, a lot of individuals with symptoms in our community, and the need right now to get testing is very high. But I also think that it isn't just relating to the surge, it's also relating to activities that our community may be doing, such as over the holiday weekend, if we were in contact with others who may, again, many times we may not know that they are infectious. It might be before their infectious period starts. There is no judgment. It's simply, this is how the virus spreads. It is effective at spreading prior to symptoms beginning. And, human nature is to have contact with others. So it really is about this balance of all of this work together. What you as individuals in our community are doing to decrease risk, making sure that you're physical distancing, wearing a face covering, and us in the health department and healthcare partnerships to make sure that folks can get tested, that we can get a hold of individuals quickly to let them know what to do and get the contacts connected with as well. So I think that there are a variety of reasons why we were able to go through all of those tests, but the fact is that 400 individuals who had symptoms came through that testing site, and that's a lot of folks in our community that may have symptoms. And we don't know yet how many of them are truly positive and may have been symptoms from something other than COVID. So I think the message there is a lot of virus in our community right now.
Hey, Jen, the school board for La Crosse has a big meeting tonight, and on the agenda is reopening schools. I was just asking to know what your conversations have looked like with them in formulating a plan to safely do that or hold back from that, and what you can tell us right now.
Yeah, thanks, Mike. So we have been communicating very closely with schools. We have a meeting every week with them. And we have been getting into more details with regards to their reopening plans. What I can tell you is that not all of the details are completely figured out yet, but the goal is to have a solid draft plan by the end of the month. So I know that school boards are going to be meeting all over our region talking about reopening of school. In our county, all of our public and private schools have been meeting together to plan. We've been a part of those meetings and advising about what seems to make sense from the information and evidence we currently have. We know that schools are having to look differently at elementary compared to middle and high school, for example. And all of the schools are really formatting their plans around the COMPASS risk levels. So if COMPASS is in high risk in orange, for example, that may look different than if COMPASS is in severe risk red. We don't currently have the plan to have schools be closed if we're in severe risk, but they need to be very planful about how to decrease the spread and the risk levels to staff and students, no matter which risk level we are in with regards to COMPASS. So it's a really big lift that schools are having to do right now, especially given some of their guidance from other entities have come just in the last couple of weeks. So they're working hard to take what we know about COMPASS and what they have from Department of Public Instruction and the WIAA to weave all of that together into the best reopening plan that supports the safety of staff and students. There are more details to be worked out. I know they're discussing things like making sure more areas of the school are available to be able to spread students out, keeping maybe them in cohorts of students so that if someone ends up being symptomatic and is infectious, that it isn't the entire classroom that has to be quarantined. Very careful active monitoring processes with staff, things about transportation and how to make sure that spread doesn't occur while kids are waiting for the bus or on the bus. All sorts of details that that work group is diligently working on. So I just give a lot of credit to schools. It's such a big lift for them to figure all of those details out, and we're doing the best we can to support them in that effort.
Do we have any other questions for Jen or Becky today? Looks like Midwest Family. Go ahead.
Yeah, can you hear me?
Mm-hmm.
All right. This is Rick at WIZM. Last week he talked about, a mask order, looking at municipalities. You said it would be a week or two. Is there any update there?
Yeah, thanks, Rick. So I do just want to clarify, and I think I did this last week as well, but I think there continues to be confusion about a health order as opposed to an ordinance. So just the note that a health order is something that a health officer under state statute 252 can do. And again, that's where some of the unknowns are there relating to the Supreme Court order over the Safer at Home order, or the Supreme Court ruling. So that that body of knowledge that we're waiting on from the Public Health Committee through the Wisconsin Counties Association, and various groups sit on that, including the Restaurant Association. That meeting is on Thursday, and I don't know if that meeting will be concluded, if that group will conclude, or if they will have something that has another meeting to finalize or not. So I know that that meeting is on Thursday afternoon. In addition, we have had some communication with municipalities in regards to where they're at with thinking about an ordinance. So an ordinance can be something passed by any municipality that is incorporated. If they are unincorporated, then that would fall to the county level. And those would all have to be passed separately in order to cover the entire county. So there are some conversations happening there as well. But those are the updates that I have at this point. So we are kind of waiting on that public health committee and conversations that are happening with municipal leaders around that particular topic.
I'm not seeing any other questions for you, Jen.
Okay, well, I will let you all go for today, and I'll see you back here again on Wednesday at 2:30. Be safe, make good choices, and appreciate all the work and energy that you're doing to decrease the spread of COVID. See you on Wednesday.